Hi, I'm Evilise Page, and thanks for listening to the Believe Big podcast, the show where we take a deep dive into your healing with health experts, integrative practitioners, biblical faith leaders, and cancer thrivers from around the globe. Welcome to today's episode on the Believe Big podcast. My name is Evilise Page. Today's episode is all about the role of hyperthermia in the treatment of cancer. I am excited for you to hear from one of the leading experts in the United States on this subject today. Dr. Pinzone received his medical degree from New York University School of Medicine and completed his residency in internal medicine at Columbia Presbyterian Medical Center. He completed a clinical and research fellowship in endocrinology, diabetes and metabolism at Massachusetts General Hospital and Harvard University Medical School. After his fellowship, he joined the faculty of George Washington University School of Medicine and then Ohio State College of Medicine. Today, he is the Chief Medical Officer overseeing, designing, and guiding and monitoring individual patient treatment plans and the delivery of hyperthermia treatments at the Hyperthermia Cancer Institute in Santa Monica, California. He also serves as the Assistant Clinical Professor of Medicine at the David Geffen School of Medicine at UCLA. Welcome, Dr. Pinzone, to the show.
Thank you very much. I am delighted to be here with you and to chat about hyperthermia.
Yes, thank you. Thank you. Well, I always like to start the show. Our listeners are always curious in discovering what everyone's favorite health tip. So could you share with us one of yours?
Sure. Mine is pretty straightforward and implicitly intuitive, and it's trust your body. So if some people know their body, and if something doesn't seem right, sure, for a day, for a week, that's one thing. Don't ignore whatever your body is telling you. Get an evaluation early. The earlier, as a doctor, I can see you in any sort of clinical situation, the better chance I have of helping you.
That's great advice. Such great advice. Yeah, I was, when we went and visited your center in Santa Monica, it was beautiful, by the way. Your staff is amazing. Really appreciated the tour and all that you do there. And I know that our listeners are also curious as to, what is hyperthermia? Many of them haven't even heard about it in the sense of cancer. So can you share with us briefly about hyperthermia and how it's used in treating cancer?
Certainly. So hyperthermia is a very, very straightforward treatment. It is simply the increase in the temperature of a tumor induced by an external device. So in our center, the technology that we use is proprietary. It is FDA approved to be used in all solid tumors in combination with chemotherapy and or with radiation therapy, and we apply ultrasound waves, and they're at a different frequency than diagnostic ultrasound waves, which are designed to bounce off of tissues. The frequencies we use are designed to penetrate, and when they penetrate those tissues, they heat to approximately 106 to 109 degrees Fahrenheit, or 41 to 43 degrees centigrade. And that does a number of things which we'll talk about. But in a nutshell, that really is what hyperthermia is the gentle heating of tumors to just above what your body might experience as a fever, but in a local way, so directly on the tumor site itself.
Yes. Okay. So I've been to Germany and I visited, some of the anthroposophical centers, hospitals there. And they use a whole body hyperthermia, and I know that yours is localized. And so can you explain the differences of, the way they use the whole body and the way that you guys use it at the Hyperthermia Cancer Institute?
Sure. Since my expertise is in our technology, I don't have a deep knowledge of whole body hyperthermia as it's used today. I will say that it's probably not really medically compatible to heat to quite the degrees that we do the entire body. But so there's no FDA approved whole body hyperthermia in this country that I'm aware of. Having said that, one of the ways that hyperthermia or that heat was discovered to be active against tumors is in the 18th century when people used to have smallpox. If you got febrile to 105 degrees for 3 weeks and you survived, a small percentage, and obviously in those days they could only evaluate tumors they could palpate, let's say, would undergo what we call tumor lysis syndrome. And so that may have been a combination of the infection, but certainly the heat contributed to that tumor lysis syndrome where the tumor would, again, small percentage of patients, would partially or totally regress, go away, sometimes permanently. So kind of got an inkling early on that heat had something interesting to do with cancer. And now we know that in addition to physiological changes and physical changes in the tumor, it also stimulates the immune system. Again, we'll get into that as our discussion proceeds. So that's what I can say about hyperthermia and the whole body being elevated in temperature. It has been noted that fever can contribute to interesting, sometimes very rewarding outcomes in cancer, but I can't really comment on the technology elsewhere because it hasn't really been evaluated, and it varies tremendously.
Yes, yes. So in the ones that the technology you use at your center, what cancers is hyperthermia treatments most effective with that you've seen?
Sure. So we are, as I say, FDA approved for all solid tumors. Having said that, there are many rare types of cancers, and it's just not feasible to look at any particular drug or device in every cancer type. We have very, very good data over the years in a number of tumors, and that includes improvement in complete response rate and improvement in overall survival in many cases, or in disease-free survival, surviving without evidence of the disease. And the strongest data comes in breast cancer, head and neck cancer, sarcoma, melanoma, and rectal cancer. There are others where there's data, and as we continue to have new cancer therapies, we'll continue to do studies looking at combining hyperthermia with those newer therapies. But as the data stands now, those are the major types of cancer where we have robust data. Many, many other cancers have data. Cervical cancer also has very, very good data. But those are kind of the main ones.
Yeah. Okay, that's wonderful to hear. So how does hyperthermia improve the effectiveness of treatments that patients are going through? Can they use it alongside of their traditional treatments? Can you do it with it?
Sure. So the way hyperthermia works is it's pretty reliable in terms of what it does within the tumor. So here's what it does in the tumor, and then I'll tell you how it applies to, let's say, chemotherapy or radiation therapy, some of the conventional treatments that many patients undergo. What happens when you heat a tumor, tumors are very dichotomous. They are quite hardy. They're kind of hard to get rid of, obviously, and yet they're abnormal. And they evolve in this really rapid fashion, okay? It's like evolution in a bottle, in a way. And so what happens is, as an example, one of the ways they're abnormal is they don't form blood vessels in general that have really good integrity. They have a lot of holes in the vessels themselves. The superstructure of the vessels is not well formed, and so the vessels tend to collapse, particularly in the center of the tumor, where you might imagine there's more pressure. Okay, so you'd figure, well, great, the cells in the center of the tumor can't survive. That's where they evolve to survive at low oxygen temperatures. So one of the things that hyperthermia does, the way we apply it, is it increases the blood flow to the tumor. So that allows systemic agents, and in the studies, traditional chemotherapy, is the systemic agent that has been studied, or a set of agents that have been studied, gets to penetrate that tumor more deeply and more completely. So that's a basic way that we work. Another thing that happens is when you deliver more blood to the center of the tumor, you deliver more oxygen. The reason why that's important is because radiation works much better in a high oxygen environment. And so we now have very good evidence that we get much more radiation effect in terms of particularly large tumors, but even small tumors. You'd be surprised that the blood vessels are not well formed. The next thing that happens is that when traditional chemotherapies, some of them, and certainly radiation therapy, damage tumor DNA, that's one of the mechanisms of how they work, because the tumor cell will then go to divide. And when it goes to divide, if the DNA is abnormal, it signals that cell's abnormal, the body needs to get rid of it. Believe it or not, since the tumor is part of your body will often have a compensatory repair of that DNA. So hyperthermia slows the repair of the DNA. And since we have no known adverse effects on normal tissue, there's no particular downside to treating the tumor and the surrounding tissue so that we can prevent the DNA from being repaired. And then finally, we actually induce what a fever would induce in that area of the body had you had a fever. And so there are a number of proteins, one of which is called heat shock protein 70. It's among many of the other ones that are induced by heat. And heat shock protein 70 seems to incite the immune system to now take some of those mutated proteins, which we term neoantigens. Now, particularly the ones that are inside the cell, some of the ones that are outside the cell, but the ones that are inside the cell and can't be seen by your immune system are now released when those cells die from the chemotherapy or when the radiation therapy kills the tumor cells. When they're released, the heat can assist in presenting those antigens that look to your body now foreign because they're so abnormal and they were hidden within the tumor. They can now be presented to T cells, and T cells are a part of our immune system that kills cells that are infected by virus, and some of them can be made to kill cells that are tumorous. So that is really the mechanism of action of hyperthermia and how it helps those other therapies work.
If someone, chooses not to do traditional treatment, so I had, surgery but I did not do traditional chemotherapy, radiation, it would not have been effective for me. Would someone be able to still do hyperthermia along, say, mistletoe therapy if they so chose to come see you?
So, you bring up a really fascinating area of medicine. So a lot of the natural agents, there's no real ownership potential for them, so there was no real impetus to do research. Having said that, that's changing. So now, as I'm sure you know, Johns Hopkins, among other places, are doing some very, very robust research on something like mistletoe. So we certainly consider that systemic therapy. We just are beginning to clarify how and where it works. So to answer your question, there are a number of patients that come to us where they don't want to do traditional therapy or they don't have that as an option. So here's the way I approach it with patients in that particular situation. I find that partnership with patients is always the best way to go. Having said that, it's a transparent two-way partnership. So we have really open dialogues, and I simply say, look, if we were to utilize hyperthermia with an alternative systemic agent like vitamin C or mistletoe, although we have emerging data that says that there might be some help, it's not as robust as with the other therapies. Some patients actually want to come to us and use just hyperthermia, and I say, well, look, again, there's no real clinical data, but I'm not here to say that that's not appropriate for you because it may or may not do something positive, and at least we are confident that there does not seem to be any harm. Not that there's no potential side effects. I mean, you can get mild burns. There are some people that get some nausea for treating around the stomach. There are some potential adverse effects that I go over with patients. But the point is that there's, in some situations, no clinical data, no study data. But in some situations, there's emerging data. And so if that's your choice, I'm happy to work with you to create a regimen as long as everything is transparent and we are all on the same page about what data exists and what we're aiming to do.
Well, we need more doctors like you around. You know, we appreciate your humility and you're willing to work with patients. You know, there are many, but there are some that are like my way or the highway. And so, you know, we really tell patients that they need to be their best advocates because they know their body's best to know what is best for them. And they're the ones that are going to have to follow through with treatments. And so, you know, my doctor even said to me, you're the CEO of your care. And like you said, it is a two-way street. It is a partnership, transparency that you work together. And when you have that open communication, it's amazing how successful that process is for patients. So really, thank you for being so open to listen to a patient's side of wanting a different approach potentially. So thank you.
Yes, well, you're welcome, and all those patients are welcome. You know, it's really taught me a lot about people having their freedom to do what they want with their body, and they have that freedom. I mean, that is part and parcel of how we interact with patients. So, you know, that's built into the DNA of our center.
Well, that's amazing. So can you explain what the process for a patient is that contacts your office on how that would go?
Sure. Many patients find us on the internet. That's probably the most common way. And on our website, hcioncology.com, we have a box where you can certainly contact us through the website. Put your name in, your first name, your last name, whatever you're comfortable with. Ask a question. And we have a team, and I'm head of that team. So that message will be evaluated, and we will reach back out to you. Most of the patients that contact us, hyperthermia is a possibility for them. And so we can have any number of folks on my team communicate with them. I often communicate with patients. I communicate with every patient that's about to do more than a drive. That is, you know, come from other states, for example. I make sure that I've contacted them and gone over with them that at least this is a real possibility. We have transition of care. We really have a bespoke process by which we welcome patients into our practice for an appropriate discussion so that everybody's on the same page at each step. The other ways that people contact us is simply by phone. They call up and they can talk to our Director of Clinical and Patient Services, Matt. He's absolutely wonderful at introducing hyperthermia and really has a welcoming spirit in a way that's just very, very rare. And then, you know, if he, in combination with me, thinks that hyperthermia is a real possibility, then we have the patient get scheduled by Caitlin, who's our Director of Clinical Operations and one of our nurses, and you get right in to see me, and then we decide together. You know, how does this look? What is it appropriate for you? That's the first question. You make the final determination. If I don't think it's appropriate, I'll tell you that's very unusual. It's more often appropriate than not. I wish patients would contact us early in their disease process, but that's pretty much how. Either through our website, you can certainly reach out through social media, but through our website or calling us directly is the most common way to reach us. And then we really take it from there. We help you with understanding whether insurance covers it. They often do. Whether you might need some transition of care, particularly if you're out of town, or if you wanted a second opinion. We have trusted doctors that practice traditional medicine, that practice integrative medicine, and we really take a holistic approach in terms of thinking about what do you as an individual need, and then make sure we set that up so that we could be of maximum benefit. Because as I mentioned, in most cases, we are adjunctive therapy on top of your parent therapy. And so we really work very closely with our colleagues throughout the medical spectrum. Again, mostly with traditional medicine, but also certainly with integrative medicine as needed.
Yeah, we've been so thankful that you all make that process very simple for patients, especially coming from out of town. You know, we've had many that have come to you, and what they appreciate is that you really work with them to find local providers that can give them, say, mistletoe therapy while they're there, or, you know, they're able to continue on with their traditional conventional treatments right there in California alongside of being treated at your center. So there isn't an interruption in the treatment process, which is really encouraging. And your team does a great job of, you know, setting those clear expectations ahead of time and really simplifying that process for so many. So we really appreciate that. And I think that was one of the things that surprised me the most was, you know, with integrative medicine, most of the time, you know, everything's out of pocket. And one of the things that you all do that's really incredible is that you do reach out to insurance companies, and I believe, you know, because it's FDA approved, is that why insurance can cover it most of the time?
Yes, that's exactly right. You know, it's very interesting. I come from, you know, you read my CV and the places that I've trained. So I am fully trained as a Western medicine doctor. That's my area of expertise. I don't have expertise in integrative medicine. I'm gaining knowledge in the area. But basically, this therapy, hyperthermia, is in fact a Western therapy. But it's universally loved because we are using a natural force, gentle heat. It just so happens that through the process of research that's happened over the last couple of centuries and to develop the technology over, let's say, the last few decades, we've hit a sweet spot. And it's one of those ones where the treatment generally is gentle. Again, I fully go through the potential adverse effects with patients, but most often they're pretty gentle. Some people sleep through the therapy. It's just amazing to me, you know, every time I walk through the door, I'm like, it's just amazing that something that is straightforward has really been demonstrated time and time again through multiple studies to just work and make something work better. I mean, it does make sense, and yet it still seems miraculous.
It absolutely does.
That's kind of like where my mind is at.
Yes. So I know that every case, every patient has an individual protocol, but can you walk us through a typical treatment of, you know,
Sure.
how long someone would need to come? What does that week typically look like?
Yes. So here's a situation where we very clearly define where there's data and where there's not data. And we try to pioneer ground as much as possible. So let me give you some examples. If we were to look directly at the studies, we would treat you each and every day and only on the days that you received radiation, if in fact that's something that were appropriate and something you decided to do, right? So that's what the studies say. Similarly, chemotherapy can often last for quite some time. So we would treat you, we're open 6 days a week, we would treat you every day during your entire chemotherapy regimen. Okay, so now let's take that and apply that to the greater reality of what patients face. And actually, our patients have interesting dilemmas. The patients that come from out of town, we recognize, you know, chances are they're not moving here. So we have a limited amount of time to treat them. And so if they're on a radiation regimen, that's usually pretty straightforward because that's still limited by the number of radiation treatments they get, usually not more than 30. If they're on chemo, it's a little bit trickier because those regimens can go on 3-4 months. We've had patients stay out for a long, long time, and we have all sorts of creative ways to potentially assist them and such. But nonetheless, it's a big commitment. So we individualize the treatment regimens to the various folks that are coming. As you say, each person's individual. Now, here's an interesting set of things that we work through. Should we begin treating before you get radiation? Should we begin treating before you get chemotherapy? And should we treat after? Those are speculative. So we have done that in some cases because we are essentially priming the tumor to get more oxygenation a little while prior to the radiation. And if you took radiation as an example, radiation effects persist for weeks to months after your last radiation treatment. So it actually makes clinical sense, although there's no data, to continue treatment beyond the time you're getting radiation. For some people, we do that. For some people, we don't. We discuss it. We figure out whether or not it's appropriate. And that's the reason why when you get your last radiation treatment, they don't immediately do, let's say, a CT or a PET CT scan, right? They'll usually wait. They being your oncologist or radiation oncologist, 3 months, 1 month, 3 months, what have you, to get that, because all of those cells are dying during that time. Similarly, the chemotherapy, although you may be getting it every week, every 2 weeks, every 3 weeks, although it doesn't stay in your body in appreciable amounts for that entire time, it is working for that time. It is continuing to work after you're getting the last dose of chemotherapy. So again, we have a conversation, and I'm very clear, if we don't have data, does it make sense to treat you? It may not. It really depends on your particular clinical situation. And we can talk about some clinical situations and some goals. That might be an interesting topic, but I'll leave it to you to lead the discussion. But that's hopefully tells you a sense of, we individualize the treatment. The patients that come from out of town usually want more of us. The patients that are here say, geez, when do I stop? And, tend to get treated a bit longer. But we individualize.
And how long is each session that they are under the
So
treatment?
we can treat, so we have 2 applicator head sizes, a larger one that's approximately 8 inches by 8 inches, and a smaller one that's used for, let's say, underneath the arm and the axilla, 4 inches by 4 inches. And it's, so the way hyperthermia is applied is pretty straightforward. You have some ultrasound gel, we have some temperature probes that go on the skin, and then some BPA-free plastic, and then there's a water bolus that's a part of the applicator head. That's cooled water. It goes against that. And then there's the applicator head, and inside are crystals that generate the ultrasound waves. So it takes probably 10 minutes or so to get up to temperature. We do that in a gentle fashion. And you're there for approximately 45 minutes. So each treatment, each site is approximately 1 hour. Now, there are many patients that come who have a single appreciable site of disease. And I say that because tumor cells shed from often very early in the tumor process. But of course, there are some patients that have multiple metastases in different parts of their body. And apart from the studies, one of the ways we know that we work is that we'll utilize it for the hour each day for, let's pretend it's 8 weeks or so. The patient will go off, they'll have a scan, and not in everybody, but when we are able to help, and that's largely dependent on whether the parent therapy is helping, mind you, that tumor will often either decrease in size, stay the same in size, the metabolic activity will go down as measured by PET scan, and yet they'll get a new tumor somewhere else. So in patients who have stage 4 disease, a lot of times we're chasing tumors throughout the body. And so one of the goals of what we're doing with those repeated therapies is making sure, first and foremost, we preserve organs you can't live without. And so one of the most common organs we treat, because so many cancers do metastasize there, for example, is your liver. Quite important organ. And so, again, each one's an hour, and we have very open discussions, and I leave it to the patient to decide with their family, with their friends, with their partners on what to do. But we're very cognizant that either 1 to 2 hours a day is quite a time commitment repeatedly. And again, for the most part, insurance covers it. Not every time. Occasionally, there's an out-of-pocket component, either to a deductible or the insurance. Some insurances don't cover it. Most do to a greater or lesser degree. And so we're very open about saying, look, this is a big commitment. Having said that, there are some situations where I can have a firmer recommendation. If we treat this tumor and get it small enough, they can do surgery and potentially cure you. Okay, you only have one shot at that. If you're getting radiation, I would 100% recommend that you get us at the least during the time you're getting the radiation. So there are certain slam dunk situations where we're good, and there are some situations where we say, does it really make sense based upon the clinical situation? So again, there too, I'm very open. I want the best for the patient, and I want them to be dedicating their time and their resources to the best place, because it is part of their life and a big part of their life.
Yes. And thank you for sharing all that. I know that hyperthermia is just one piece of the large puzzle, just like mistletoe therapy was for me. But as we close today's podcast, I can't believe it's already been 30 minutes. I try and keep them to about 30 minutes. We could spend 3 hours on this, I'm sure.
Good indeed.
But is there a patient story that stands out that you can share with us from your practice?
Yes. So we actually had a woman who we ended up, she was a family friend, and she came to us and she had breast cancer. And she had not a very large tumor, but the idea was she was going to have neoadjuvant chemotherapy, and that is chemotherapy before her planned lumpectomy. Well, it turned out, I'll share two. This is one. So it turned out that by the time they went to do the lumpectomy, out of a medium-sized tumor, there was nothing to be found except the gold bead that they placed when they did the biopsy.
Wow.
So that was really an outsized response where we are fairly, you can't separate the therapies, but we're fairly certain we helped her.
Amazing.
And the last one I'll share, and then we'll stop because I know we're out of time, but I get excited about these things, is we had a lovely, lovely lady who was in her later 70s. She had a medical doctor in the family who was very intrigued by what we do, and she had vaginal cancer. And so she needed radiation therapy. She came from out of town, and we set her up with the radiation oncologist. And the way vaginal cancer is typically treated, it varies, but common treatment is you get external beam radiation followed by brachytherapy, meaning implantation of radioactive pellets for a period of time. This particular woman had a response, a complete response, tumor gone with just the external beam. That was the first time in the over 30 years of experience of this radiation oncologist that she'd ever seen anybody with vaginal cancer have a complete response with just the external beam. Now, she went on to have the brachytherapy just for good measure, mind you, but it was one of those ones where it was the moment, that was the moment that this really unbelievably brilliant radiation oncologist really said, wow. And you have those wow. I had to have my own actually when I came to. So those are two for you where we've gotten people saying to the patient, to us either directly or through the patient, this is an absolutely amazing response. I wish it happened with every patient. It doesn't, but it does in some cases, and you can only have it happen if you have the therapy. So there you have it.
Amazing. That's amazing. That might just make you feel such a reward for the hard work that you all put in, and to hear stories like that, it must be so encouraging to all of you that are working there. We are so grateful for the Hyperthermia Cancer Institute and all that you do for patients around the country and even the globe, and we're just so grateful for you. And so thank you so much for taking time out of your busy schedule to speak with us today.
Well, thank you so much for having me. It was a real pleasure.
All right, you have a great day.
You too. Thank you.
If you enjoyed this episode and you'd like to help support our podcast, please subscribe and share it with others. Be sure to visit believebig.org to access the show notes and discover our bonus content. Thanks again, and keep believing big.